Hey everyone, welcome back.
Ugh, Ross, you sound terrible today.
I know, I've been feeling awful.
Actually, that's perfect for today's episode.
We're doing a hospital scene play,
A doctor's visit.
and I really do have a headache.
So this will be very realistic.
Have you ever needed to see a doctor abroad?
It can be scary, especially in English.
But today, we'll show you exactly what to say.
From the moment you walk in,
Until you leave with your treatment plan.
I'll be the doctor,
And I'll be the not-so-healthy patient.
which isn't much of a stretch today.
Thanks, Pepper.
Just keeping it real.
All right, let's do this.
To the clinic we go.
Okay, so I'm not feeling well today.
I've had a headache for 3 days.
And I'm feeling tired all the time.
My throat is a bit sore too.
I think I should see a doctor.
So I'm going to a local clinic
I arrive at the clinic.
and approach the reception desk.
There's a receptionist there.
But in our scene, I'll play all the roles.
So I'm walking up to the desk now.
I'm the receptionist first.
Good morning.
How can I help you?
Good morning.
I'd like to see a doctor, please.
I'm not feeling well.
Okay, do you have an appointment?
No, I don't.
Is this urgent?
Not urgent.
But I'd like to be seen today.
If possible.
All right, let me check.
We have an opening in about 30 minutes.
That would be great. Thank you.
Can I have your name, please?
Yes, it's Ross Johnson.
And your date of birth?
March 15th, 1995.
Thank you.
Have you been to our clinic before?
No. This is my first time.
Okay, I'll need you to fill out this form.
It asks for your medical history.
Current medications, allergies.
Things like that. Sure, I can do that.
Great.
You can have a seat in the waiting area.
The doctor will call you when ready.
Thank you so much. Now I'm sitting in the waiting room.
Filling out the medical form.
It asks a lot of questions.
Previous illnesses, surgeries.
And family history? I answer everything honestly.
It's important to give accurate information.
The waiting room is quiet.
A few other patients are here.
Some reading magazines.
Others looking at their phones.
There's a water dispenser in the corner.
And some health posters on the walls.
About hand washing and flu prevention.
After about 25 minutes,
I hear my name called.
Ross Johnson.
That's me.
Right this way, please. Now I'm the doctor.
The patient enters my consultation room.
I stand up to greet them.
Good morning.
Please come in and have a sit.
Thank you, doctor.
I'm Dr. Martinez.
Nice to meet you.
Nice to meet you too.
So, what brings you in today?
Well, I haven't been feeling well.
I see.
Can you tell me more about your symptoms?
Sure.
I've had a headache for about 3 days now.
A constant headache?
Or does it come and go?
It's pretty constant.
Sometimes it's worse than other times.
Where exactly is the pain?
Mostly in my forehead.
And behind my eyes?
On a scale of 1 to 10.
How severe is the pain?
Usually around a 5 or 6.
But sometimes it goes up to 7.
I see.
Any other symptoms?
Yes, I'm feeling very tired.
Even after a full night's sleep?
And my throat is a bit sore.
When did you first notice these symptoms?
The headache started 3 days ago.
The fatigue has been building up over the past week.
And the sore throat?
That started yesterday?
Have you had a fever?
I'm not sure,
I feel a bit warm sometimes.
but I haven't taken my temperature.
Okay, we'll check that.
Any nausea or vomiting?
No, nothing like that.
How about your appetite?
It's been lower than usual.
I just don't feel like eating much.
Understandable.
Are you taking any medications currently?
Just some ibuprofen for the headache.
But it doesn't help much.
Any allergies I should know about?
Yes, I'm allergic to penicillin.
Important.
I'll make a note of that.
Thank you.
Now, let me ask about your lifestyle.
How have you been sleeping?
Not great, actually.
I wake up several times during the night.
That could contribute to the fatigue.
Have you been under stress lately?
Yes, quite a bit.
Work has been very busy.
Stress can definitely affect your health.
How about your diet?
Has it been regular?
Mostly yes.
Though I've been eating less these past few days.
And drinking enough water?
Probably not as much as I should.
That's something we should address.
Do you smoke?
No, I don't.
Drink alcohol?
Occasionally, but not recently.
Good.
Now, I'd like to do a physical examination.
Is that okay?
Yes, of course.
Let me start by checking your vital signs.
First, I'll take your temperature.
Opens thermometer.
Open your mouth, please.
Under the tongue.
Okay,
Waits for beep.
your temperature is 38.2 Celsius.
That's about 100.8 Fahrenheit.
So you do have a slight fever.
Now let me check your blood pressure.
Roll up your sleeve, please.
Puts on cuff.
You'll feel some pressure.
That's normal.
Okay.
Pumps and releases.
Your blood pressure is 120/80.
That's perfectly normal.
Good.
Now I'll check your heart rate.
Chest pulse.
75 beats per minute.
Also normal.
Now I'm going to listen to your heart.
And your lungs. I'll use this stethoscope.
Please take deep breaths when I ask.
Okay.
Place a stethoscope on chest
Deep breath in.
and out.
Again.
Inhales and exhales.
Your lungs sound clear.
No signs of congestion.
That's good.
Now let me check your throat.
Open wide and say ah.
Ah.
Uses tongue depressor and light.
Your throat is red.
And inflamed. There's some swelling in your tonsils.
I see.
Any pain when you swallow?
A little bit. Yes.
Let me check your ears too.
Uses otoscope.
Your ears look fine.
No infection there.
Now, let me feel your neck.
Gently palpates lymph nodes.
Your lymph nodes are slightly swollen.
This is common with infections.
Does this hurt?
A little tender, but not too bad.
Okay, thank you.
You can relax now.
Based on your symptoms.
And the examination. I believe you have a viral infection.
Probably a common cold or mild flu.
Is it serious?
No, it's not serious.
But it does explain your symptoms. And the fatigue. These are all typical signs.
How long will it take to recover?
Usually, these infections last 5 to 7 days.
You're on day 3.
So you should start feeling better in a few more days.
That's a relief.
The good news is,
Your lungs are clear,
and your vital signs are stable,
so we don't need to worry about complications.
like pneumonia or bronchitis.
That's good to hear.
Now, let's talk about treatment.
Unfortunately, there's no cure for viral infections
Antibiotics won't help.
because antibiotics only work on bacteria.
Not viruses.
So what should I do?
The best treatment is supportive care.
That means helping your body fight the infection.
First, get plenty of rest.
Your body needs energy to heal.
Try to sleep 8 to 10 hours a night.
And take naps if you need to.
Second, drink lots of fluids.
Water, herbal tea, warm soup,
This helps thin mucus.
and prevents dehydration.
Aim for at least 8 glasses of water.
Per day, or if you have a fever.
Third, for the headache and fever.
You can continue taking ibuprofen.
Or you can try acetaminophen.
That's also known as Tylenol or
What's the dosage?
for ibuprofen, 400 milligrams.
Every 6 hours as needed.
Don't exceed 3 doses.
In 24 hours. For acetaminophen, 500 milligrams.
Every 4 to 6 hours as needed.
Okay, I can do that.
For your sore throat.
Try gargling with warm salt water.
Mix half a teaspoon of salt.
In a glass of warm water.
Gargle several times a day.
This reduces inflammation.
You can also try throat lozenges.
Or honey and lemon tea.
Those are very soothing
That sounds nice.
for overall comfort,
Use a humidifier in your room.
especially at night,
This adds moisture to the air.
and helps with congestion.
If you don't have a humidifier,
You can breathe steam from a hot shower.
or a bowl of hot water,
Be careful not to burn yourself.
of course,
Now, about your diet.
even though you don't feel hungry.
Try to eat small, light meals.
Chicken soup is excellent.
It's nutritious and easy to digest,
Fresh fruits with vitamin C.
like oranges or strawberries.
These support your immune system.
Avoid heavy, greasy foods.
And stay away from dairy if it increases mucus.
Should I avoid going to work?
Yes, I recommend staying home.
For 2 reasons.
First, you need rest to recover.
Second, you're contagious.
You could spread the infection to others,
Stay home for at least 2 more days,
or until your fever's gone.
or 24 hours. Okay, I'll do that.
Are there any warning signs I should watch for?
Good question.
Call me or go to urgent care if
Your fever goes above 39 Celsius, or if it lasts more than 3 days,
if you develop chest pain,
or difficulty breathing.
if your symptoms get significantly worse,
Instead of better,
or if you can't keep fluids down.
due to vomiting.
These could indicate complications.
But I don't think that will happen.
You are young and otherwise healthy.
You should recover just fine.
That's reassuring. Thank you.
I'd like you to come back
For a follow-up,
in about a week, just to make sure you're fully recovered.
can I schedule that now?
Yes, stop by the reception desk.
They'll set that up for you.
Do you have any other questions?
I don't think so.
You've been very thorough.
Good.
Remember, rest and fluids are key.
Your body knows how to heal itself.
You just need to give it the support it needs.
I will. Thank you so much, doctor.
You're welcome.
Take care and feel better soon.
Thank you.
Okay. Back to being ourselves now.
So that's what a doctor's visit looks like in English.
Pretty straightforward, right?
The key is being specific about your symptoms.
When did it start?
Where does it hurt?
How bad is it?
Those 3 questions help a lot.
And don't forget to mention allergies.
That's super important.
especially to medications.
It could be dangerous if you don't tell them.
Some phrases you definitely need to know.
I'd like to see a doctor, please.
That's how you start.
I've been feeling unwell.
Or I'm not feeling well.
Both work perfectly.
Then describe what's wrong.
I have a headache.
My throat hurts.
I've had a fever since yesterday.
Be clear and honest.
Doctors can only help if they know what's happening.
During the exam, just relax.
They might say, open your mouth.
Or take a deep breath. Just follow along.
If something hurts, tell them.
That's a bit tender.
Or, out, that hurts.
They need to know.
When you get your diagnosis.
Make sure you understand it.
Ask questions if you're confused.
What exactly does that mean?
How did I get this?
Is it contagious?
All perfectly okay to ask.
Then listen carefully to the treatment plan.
How to take medicine.
When to take it.
Any side effects to watch for.
When to come back.
Write it down if you need to.
Quick vocabulary review.
Common symptoms are headache and fever.
Also cough. Sore throat, nausea, and dizziness.
Fatigue, body parts you might need.
Head, throat, and chest.
Stomach, back. Common medications.
Pain relievers like ibuprofen.
Fever reducers like acetaminophen.
Antibiotics for bacterial infections.
But remember, not for viral infections.
And throat lozenges for sore throats.
A few practical tips before we go.
If you're traveling,
Know where the nearest clinic is before you need it.
bring a list of your medications.
And your allergies.
Written down in English.
It makes everything easier.
And if you're really worried,
Bring a friend.
someone who speaks English well. They can help translate or clarify.
Oh, and one more thing.
In some countries, you pay upfront.
Then claim insurance later.
In others, insurance is billed directly.
Know the system before you go.
And always keep your receipts.
Alright, we hope this helps you feel more confident.
About visiting doctors in English.
You've got this.
Just remember to be clear and specific.
And don't be shy about asking questions.
Your health is important.
Take care of yourself.
Thanks for watching today's scene play.
Stay healthy, everyone.
See you next time.
Bye.